A very good morning. It gives me immense pleasure to extend a warm welcome to one and all. Today, on August 13, we are celebrating National Organ Donation Day. Union Ministry of Health and Family Welfare, Government of India launched Organ Donation Day in the year 2010 in New Delhi. Organ Donation Day was established with the focus to spread information and make people aware of organ donation. The day also attempts to eliminate the fears and the myths people have in their mind about organ donation. On this day, people are educated on organ donation that can be life changing for many, and the practice can give a new life to the ones in need. Here, today with us, we are having eminent speakers to provide valuable information regarding organ donation.
It is my privilege to be associated for the organ donation program on the occasion of World Organ Donation Day. And as the topic itself is organ donation, a gift of life. So I would like to share my some few thoughts and some of the videos which I will also share, which will make the things more easier to understand. Can I have the slides, please? Yeah, thank you so much. As the topic itself says that it is organ donation, a true gift of life. Why donate organs? More than 2 lakh Indians require organs transplant annually. This is a complete, this is only the number for kidney. But if you add the liver, heart, and other vital organs, it can go up to even 5 lakhs. But only less than 10% are able to get timely help. Interestingly, at least 10 patients die every day while on waiting list for the organs across India. Every 10 minutes, a new name is added to the waiting list, and Dr. Kishore Phadke is facing a tough time because the waiting list is so large, and we are not able to do anything. And every day, new patients are getting added. An organ wasted is a loss, life lost. Next slide, please. So who can donate organ? Anyone, at any age, any religion, any caste. There are two types of donations. One is living donor, where kidneys and part of the liver can be donated. It can be done by the immediate blood relatives or unrelated friends. And this all can be done only with the donor consent. There is another one measure for which we are now today meeting is the deceased donor organ donation, where most of the organs can be donated after brain death. Only consent from the family next to kin is required, and it is a very transparent system. No monetary benefit for the donor family at all. Next slide, please. So, since you are all associated, you are already studying in your college, since you are all the nursing students, you know what is brain death. It is severe, irreversible injury to the brain, all areas of brain damaged, and stops all the activities of the body. Persons can't sustain life on own, even though vital functions may be maintained artificially. At this juncture, I would like to request Mrs. Nancy to show the video to make it more understanding about what is brain death.
I am Dr. Sandeep Vash, and I have been a practicing neurosurgeon for the past 20 years. Over the next 5 minutes, I shall explain what brain death is. Brain death or neurological death is a term not well understood by the public. People tend to confuse brain death with coma. This animation will explain what brain death is and how it is substantially different from coma. Let us start by understanding anatomy. The brain consists of two parts, the cortex and the brainstem. The cortex is the larger part of the brain and the brainstem is the smaller. The brainstem is actually the top of the spinal cord. The cortex controls higher functioning activities such as reading, writing, and talking. If the cortex is seriously damaged, the person might enter coma and lose consciousness. But even in coma, a person might still feel pain or respond to stimuli. And sometimes a comatose patient might regain consciousness. Brain death is, however, different from coma. It's a term used to describe the whole brain dying, both the cortex and the brainstem. The brainstem is the central nervous system of the human body and the center of consciousness. If the brainstem dies, respiration would stop. Once the heart stops receiving oxygen, it too would die and stop beating, and all other organs will also die due to oxygen deprivation. How does brain death occur? If a person receives a serious blow to the head or has a major stroke, the brain might begin to swell. Since the skull is made of hard bone, it doesn't allow the brain to expand. Physicians can try medication or surgery to reduce the swelling, but if this does not succeed, the pressure on the brain can grow greater than the pressure of the beating heart. Once this happens, the heart can no longer hold oxygenated blood into the brain. With no supply to the brain cells die due to the lack of oxygen. In fact, the cells don't just die. A process called lysis begins, where cells begin to liquefy. This liquefaction makes the brain death irreversible. Once the brainstem dies, the person stops breathing, and the heart and the rest of the organs die due to oxygen deprivation. How do we know the brainstem has died? Modern medicine has lots of ways to determine if the brainstem has died. One way is to check for the neurological activities that the brainstem controls. If the person is not conscious, cannot breathe, cannot swallow or cough, pupils do not respond to light, these are all signs the brainstem has died. In India, the Transplantation of Human Organs Act of 1994 specifies a series of tests that need to be performed by a team of 4 doctors before brain death is declared. The tests are performed twice with an interval of 6 hours. But how is it possible for the heart of a brain dead patient to keep beating? Where does the heart get oxygen from? The patient has been put on a ventilator to help him breathe. Afterwards, the brainstem dies. Even though the brainstem is dead and the lungs no longer function, the heart continues to beat because it is artificially being supplied oxygen from the ventilator. If the brainstem and the rest of the brain is dead, what is instructing the heart to beat? The heart is independent of the brain and is simply an automatic pump. As long as the heart gets oxygen from the ventilator, it will continue beating for a short period of time. After the onset of brain death, if the deceased is left on the ventilator, how long would the dead body heart continue to beat? The heart can beat for a few more hours, sometimes even a few weeks. On an average, the heart would beat for 2 or 3 days and then die. Brainstem death is death. It is irreversible, and systemic failure of all organs is inevitable. Woken up from brain death. If brain death means the patient has died, why does the body feel warm in the touch and looks like it's sleeping? The human being, the organism, is dead, but the organs, such as the heart, are kept alive for a few more days, giving the appearance of a sleeping person. An organ can be kept alive even outside the body by giving it oxygen. But the person is dead once the brain is dead. A brain dead patient is not a person suffering from brain death. He is dead. Once death has been established, the question facing the family in that situation is what to do. Should the family wait till the loved one's heart stops beating? Or should they express their wish to donate organs and save other people's lives? Emotionally, it's a difficult choice, and every family has to do what they feel is right.
So what we have seen is the establishing the brain death, which has strict guidelines down by the law. And what we have seen is in the video is it is certified by a team of 4 doctors, not connected with the transplant. It is done at the interval of 6 hours twice by 4 doctors. And interestingly, this cannot be done at all the centers, all the hospitals. For this, there needs a appropriate license. And the licensing authority is the respective state government. And I'm sure all the students are from different uh, states. So every state has to certify for the licensing for brainstem death committee and also for the transplant. So what we have seen, the Human Organ Transplant Act 1994, as we saw even in the video also, it is a legalized the concept of brain death, thereby facilitating the organ procurement from heart beating or brain dead donors. This is primary objective was to stop the commercial dealing of organs, especially the kidneys, which happened before 1994. So, as I mentioned to you earlier, there are two types of donations. One is live related, unrelated, and the deceased donor. And what we are talking today is the deceased donor organ donation. There can be primarily three causes of brain death. One is trauma and maybe stroke or even the brain tumor. Next slide, please. So which organs can be donated? In case of circulatory death, only tissues like skin, corneas, heart walls, or bone can be donated. All parts of the organs can be donated, including lungs, heart, liver. Liver also can be donated to the two people. Pancreas, small intestine, kidneys, all parts. Apart from that, even skin, heart walls, bones, everything can be donated. That is the beauty of this disease donation, organ donation. Next slide, please. Now you can just play the video about role of MOHAN Foundation.
India is struggling with an acute organ shortage, as is evident here. It has amongst the lowest organ donation rates in the world. Lakhs of patients die tragically while waiting for an organ. A single organ donor can save up to 8 lives and heal many more. Such is the power of organ donation. MOHAN Foundation began advocating this cause at a time when no one in the country was talking about it, and the environment was fairly hostile towards this taboo topic. It has been striving to create awareness and remove myths in the society. It has innovatively shown the way forward to various stakeholders. It has also been building capacities of medical professionals and has been the foremost training body helping create a cadre of professionals called the transplant coordinators. Its unique e-learning course is the first of its kind in the region. The transplant coordinators do the unenviable task of counseling families to encourage them to donate the organs of their deceased loved ones, thereby saving multiple lives. Over the years, it has expanded its outreach to newer Indian states by working closely with state governments. The foundation works with several hospitals to help them put systems in place. It has been liaising with government bodies to pass favorable legislations. All this has resulted in an increase in donations over the years. The helpline that started off as an information tool has also been coordinating for real-time donations, including one in Dubai. The foundation has effectively used technology to assist medical and paramedical professionals. It has also developed and maintains web registries for organ distribution in various states. Thanks to MOHAN Foundation's consistent advocacy for inclusion of organ donation wish in the driving licenses, the Indian government introduced the same in April 2018. In its constant quest for spreading awareness, it came up with innovative ways like lighting up of significant monuments across the country in green and showcasing unique exhibitions such as Life Before Ashes to evoke public consciousness. MOHAN Foundation's work has been acknowledged at various forums and has been recognized through many prestigious awards.
So what we can do now? What we can do is we can pledge our organs. We can spread the message to the other people, public and society. You can volunteer. Most important thing is you have to carry the donor card. But also one has to tell the family members the last wish, because Indian laws do not only accept the pledge by legally. It has to be the next to kin has to give the consent for retrieval of the organs. Next slide, please. Let us understand about some myths and facts about organ donation. Next slide. So one of the myth is my religion discourages organ donation. Actually, if you see, all major religions allow organ donation. In fact, religions endorse the act of giving, and what bigger form of giving can there be, giving the life itself? In case if anybody has the doubt, they can always take the opinion of the religious leaders for any clarification. Next slide, please. Donor family will have to pay more money to the hospital is a myth. Actually, after declaration of the death, the hospitals bear all the expenses of artificially supporting the donor. Next slide, please. If the family agrees to donation, doctors will not try hard to save the patient life. It's the biggest myth. But actually, when you go to the hospital for treatment, doctors focus on saving life, not somebody else's. The option to donate organs is offered only after a person is medically declared dead, and that too as per the Human Organ Transplant Act. The doctors in charge for the care has nothing to do with the transplantation, because this is all done in the ICU setup. The transplant team is totally different. There's no connection. Next slide, please. What if I recover from the brain death? And you have seen already the video. It is impossible to recover from the brain death. It is not the same as coma. In fact, people who have agreed to organ donation have to undergo additional tests at no extra cost to the family to determine that they are truly brain dead. So that is the reason there are 4 doctors, different time intervals, the certification is done. Next slide, please. If I donate organs, I'll be born without them in the next birth. Is another big myth. Organs are destroyed anyway when your one is cremated. That means either they are burnt or the buried, whatever the religion follows. The physical body does not survive death. So organs hold no relevance when you believe in rebirth. So that myth is absolutely, even we keep hearing about it. And that is one of the reasons why many times people don't come forward for the organ donation. Another myth is organ donation mutilates the body, which is not true. Donated organs are removed surgically, which does not disfigure the body at all. Also, since the donor body is clothed for cremation, there is no visible signs of donation. So let us see another small video. What is the success of the transplant? A video, please.
Yeah. धन्यवाद
धन्यवाद नंदी
नन्ही
I would like to first acknowledge the efforts taken by your organization and the organizing. Would like to applaud the organizing team for organizing this awareness function, the awareness about organ donation, which is so important uh, to be aware of the organs which can be donated and the whole program, because so many lives can be saved. Now, can I have the next slide, please? Yes. A medical professional should give everything to preserve. To preserve what? Next. To preserve life. That's what a medical professional is trained to do, and that's what he ends up doing after his training. So let me tell you about one story, a real life story. Next slide, please. This was our first deceased donor transplant that took place in the state of Karnataka in 1995. She was a medical student studying in Mysore Medical College. Her parents used to live in Bangalore. She wanted to join medicine because she wanted to help others. So she was very devoted and a committed person. Unfortunately, she had a very fatal accident when she was traveling from Mysore to Bangalore on a weekend. After the accident, she was brought to Nimans for treatment. And Nimans doctors tried everything to save her, but it was a very bad accident and they could not save her. She became brain dead. What does it mean? Her brain had stopped functioning, but the heart was beating. The heart was beating. She was on ventilator in the ICU. And then she became brain dead. At that point of time, her parents came forward and they said that we would like to donate her organs. We are convinced that she will never come back to life because although her heart is beating and she is breathing on a ventilator in the ICU, her brain is dead. She cannot come back to life. But we would like her to continue to live by donating her organs in somebody else's body. After all, after death, our soul leaves the body and then enters into another body, right? That's our Hindu mythology. And it's the mythology of all other religions. So her parents' wishes were respected and her organs were removed, retrieved, and given to the needy people who had kidney failure and who were on dialysis. So these two organs were given to two individuals. This was our first deceased donor transplant that took place in the state of Karnataka. And now there have been several. Next slide, please. So this is the media coverage that we got after her organs were retrieved, after her parents gave consent. So even in her death, she saved lives. Even normally during life, when we are living, we want to do something good. We want to help others. What about after our death? Even then, we can continue to help others. So, and we do this for a social cause, for a good cause, and not expecting anything in return. It is a donation or it's a contribution. It's not a sale. So that's what Usha Gauri's parents said. We don't want anything out of it. We want other people to get a fresh lease of life. So there is no financial incentive. It is a altruistic act to donate organs. There is no commerce involved. Next slide. So we felicitate this donor family at Raj Bhavan, where the governor of Karnataka is felicitating Usha Gauri's father, who had taken a big decision to donate organs of his daughter in the middle of a panic or a tragic situation for himself and his family, losing her. But then he wanted to help others, and she wanted to help others, and she had expressed that to the father earlier, that I want to do something good. And that's how this transplant took place. Next slide, please. So we felicitate them, we give them a certificate. Please remember, there is no financial incentive. They want to do something good by donating organs, not expecting anything in return. Next slide, please. Now, to run a disease donor program, what is the infrastructure you need? Now, before that, let me tell you, suppose there is somebody who dies at home. Can you take his organs? No, you cannot take his organs, because when the person dies at home, his heart has stopped beating, he's not breathing, there is no oxygenation, so all the other organs also die. So you cannot take organs if somebody dies at home. You can only take some tissues, like for example corneas, which is a part of the eyes, because the cornea is a structure which doesn't need a blood supply. So you can retrieve eyes only, and that too within 6 hours after regular death or cardiac death or cardiorespiratory death, as we call it. So a deceased donor who has, in order to donate organs, has to be in the ICU in a hospital, on ventilator and on organs support system. So that is the infrastructure we need. And we have it. We have it in Bangalore. We have so many hospitals in government sector and private sector which have facilities to support the donor for his to trying to save him. If it doesn't work out, to support him, support his organs, and to retrieve organs. We have a legal framework. The Human Organ Transplant Act of 1994 defines brain death. Prior to that, it was only heart death or cardiac death. Only when your heart stops beating, you call somebody dead. But even brain death is death, and death is death. Once you die, you can't come back to life. Then we need medical facilities, which we have. We also need an organizational structure. Next slide, please. And that is what is called Jiva Sarthakate. So the Jiva Sarthakate is the apex body formed by Department of Health and Family Welfare, Government of Karnataka. It coordinates. Whenever there is a brain dead patient in some hospital, they will inform Jiva Sarthakate, and they will coordinate, talk to the family, counsel the family, and only when they give consent, we proceed with organ retrieval. And once the organs are retrieved, then these organs are allocated to the needy individuals. And already Mr. Sridhar has told you that one person can save so many lives, 8-10 lives, and so many others are benefited because of tissues. So for this organ donation program to to be present and to progress, because it's a life-saving program, there are certain principles we need to keep in mind. One is that this is related to the donor who is in the ICU, who is in the um, who's on ventilator. Normally, after cardiac death, we don't continue treatment for a patient, but for this patient, we continue treatment till we decide about the organ retrieval, because the organs have to be kept in good condition. So the heart has to be kept beating, the ventilator has to be on to supply oxygen, and so on. So continuation of care beyond death is an important concept that one must understand. Similarly, the organs are retrieved in one hospital, but they may be allocated to different hospitals. So liver may go to hospital A, heart may go to hospital B, two kidneys may go to hospital C and D, pancreas may go to another hospital, eyes may go to the eye banks, and heart valves may go to separate at different hospitals. So there is a concept of sharing of organs. So the organs are, after death, they belong to the family, right? So they belong to the family, they give consent, and then we proceed with organ retrieval. So we must follow ethical procedures. There should not be any trade or commerce involved. It involves teamwork because so many hospitals are involved. And so the most important member of the team is the donor family who makes a decision to donate organs. Those are the real heroes. They can be compared to soldiers, who give up their life fighting for the country. So here also the organs are donated to save lives of people who need them for survival. People who have end-stage organ failure, kidney, heart, liver, they are in desperate need to receive organs in order to survive. And that's what is the basis of this organ donation program. Next slide, please. So we need an organizational structure, as I told you, that's called Jiva Sarthakate, because it involves so many hospitals. It's not one hospital, it's many hospitals. And somebody needs to coordinate, and we need a hospital independent structure. And that's what this Jiva Sarthakate. And because we want to maintain transparency in the system, we want to make sure that justice is provided to all the socio-economic people with different socio-economic status. And if we don't have patients to receive the organs who are suitable, we have even transported these organs to other states so that some needy person there will benefit and the organs don't get wasted. The organ wasted are lives lost. So one donor can save so many lives, 8 lives, and as many as 50 people who will receive different tissues. The tissues that can be donated, the organs that can be donated are normally kidneys, 2 kidneys, heart, liver, 2 lungs, pancreas, small intestine. These are the organs. What are the tissues? Cornea, heart valves, skin, tendons, blood vessels, and so on. So how many such donations have happened in Karnataka? In last year, 2019, we had 105 donors. The donor families agreed for the organ retrieval. But sometimes some of these organs may not be fit or may not be suitable. So there were 105 donors throughout the year in different hospitals. We were able to retrieve liver in 86 of them. So 86 people got a liver transplant. 163 patients received kidneys. The number is more than the donors because there are 2 kidneys that we have. 28 heart transplants took place, 30 lung transplants took place, Sometimes we do combined transplant, kidney and liver, kidney and pancreas, heart and lungs, and so on. 154 people got a new vision with the corneal transplant. Heart valve, skin is used for treatment of burns by plastic surgeons to improve the wound healing. So we have to donate organs. We want to create awareness. So we had organized a walkathon, depicting the importance of the organ donation. That's where we had prepared this poster. Donate your organs and start with your legs. I think all of you know this person, very well known, Anil Kumble, as a cricketer. He says that after I die, after I finish my first innings, I want to donate my organs and start a second innings. So the celebrities play a very important role. It's very important that the celebrities keep on telling the masses that do this. Aishwarya Rai says, I want to donate my eyes. That is how we have to build up the awareness. Everybody talking about it, sensitization, awareness programs, putting it on driving license, having events, felicitate the donor families, have gadgets such as T-shirts, car stickers, and so on. So there are so many ways of creating awareness. And all of you should not only pledge your organs and be ready to donate organs, but also talk to your family about it, talk to everybody, take active part in creating public awareness on organ donation. Next. So this was the first transplant that took place. As you know, the elephant's trunk was transplanted. We need it, the society needs it, and we donate our organs, and when the donor families donate, they don't even know where the organs are going. They will be given to the most eligible person. So that is the height of morality and this thing, that they want to do something good for others, and they don't even know who are those people who will benefit. So let's create awareness about organ donation. We must give our today, next, for somebody's tomorrow. Next. So as I mentioned before, we don't want to waste organs. We don't want to burn them, bury them. We want to run a deceased donor program where we, after taking the consent from the family, retrieve the organs and transplant them into people who need it for survival. So although for somebody, like a donor, accident victim who has died, and you may consider that it is his end, but actually it is the beginning for so many people who are able to live because of his organs. Thank you very much.